The following is a preview of the classroom presentation material provided for each topic in our courses offered through LearnMedicalCodingOnline.com. Enjoy. Okay, so the introduction to CPT. CPT stands for Current Procedural Terminology. This was developed by the AMA in 1966. These are 5-digit codes to report services provided to patients. It's updated or published in November for use in January. In 1983, the use of CPT was increased when the CMS incorporated the CPT into HCPCS codes, and that's what the HCPCS stands for. If you don't have that written down anywhere in your books, and I don't know that it says it on your HCPCS manual, you can write that down because there are questions that ask you, which one of these choices is the correct answer for HCPCS. Okay, CPT codes allow communication that is both effective and efficient. It informs third-party payers or insurance companies of services and procedures that are provided, and these are used as a basis of payment. So what it does is it turns long medical statements into numbers so that the insurance companies can understand. Types of CPT codes, which are also called Category 1 codes. There are medical, surgical, diagnostic services, and anesthesia. Okay, if you flip open your manual to the inside cover, you'll see the next few things I'm going to reference. Up in the top left-hand corner of the inside cover of your manual, you have a place for symbols. This is also located on the bottom of each of your pages. Whenever you're doing your coding, you can reference the key at the bottom of the page to see just what a symbol could stand for. All right, page 2. Also a picture of your inside cover. So once again, the symbols up in the left-hand corner, and then we have our list of current modifiers that goes from, in my copy, 22 to 99. Is that what yours says? Start with 22 and go to 99? Okay, and then you have Category 2 modifiers at the bottom. Those are performance modifiers that we're not going to use. Then in the second column, we have anesthesia physical status modifiers, which we'll use specifically for anesthesia. Modifiers approved for hospital outpatient use. Those are doubles of what is in the first column, but it just tells you which ones you can use if the patient's not in the hospital. And then you have level 2 or HCPCS modifiers, which stand for sides of the body, fingers, things like that. Okay, the next page references the anesthesia guidelines. There are guidelines at the beginning of every section that cover information for the entire section, which brings me to my notes describing guidelines and different types of codes on page 6. Okay, does everybody see this page that starts with guidelines? No answers? Nobody's talking to me? Yes. Thank you. Okay, guidelines. Guidelines are section-specific information at the beginning of each section. Okay, within them, it should describe the difference between standalone codes and indented codes. Those are our two types of codes we're going to deal with. A standalone code provides a full description of that procedure or service. An indented code is a code that depends on the preceding standalone code for a complete description, and I have an example. A semicolon is, so for the description preceding the semicolon is the common part of the description and applies to the indented codes that are under it. Words following the semicolon indicate alternative sites, procedures, and descriptions of the extent of service. So if we just look at the difference between code 22600 and 22610, 22600 says arthrodesis, posterior and posterolateral technique, single level, cervical. So do you see where the semicolon is after single level? Okay. So instead of just reprinting all that information down to the next code of 22610, they're putting in a semicolon and telling us for the code that was listed previously, now throw in the word thoracic. So 22610 in actuality reads arthrodesis, posterior or posterolateral technique, single level thoracic. So that's where that description changes.
Like up above the cervical, down below the thoracic.
Right, and that's when we go through and highlight, that's the differences that we're highlighting. But it all depends on that first code. And remember, that first one that's listed there, the 22600, that is an example of a standalone code. It has the full description and everything. The next one is indented. It depends on the preceding code in order to get its full description. Okay, modifiers. Modifiers provide additional information about services provided to the patient. They are listed in the front of the CPT manual, and there is a description of each one in Appendix A. And we've gone through modifiers already. But what modifiers do is they affect the payment, how something is paid, because some way or another it changes the code or gives information to the code that allows for it to be paid, where in normal circumstances it wouldn't be. Unlisted services is next. These are codes that end in 99. These are only used when there is no more specific code. When you use an unlisted service code, you must have a special report attached with it. And what that report would describe is everything you did in that procedure, and basically explaining why this doesn't fall into another category that they already have a code for. A special report is used to describe the service or procedure. This leads to new codes and revisions if enough of the same type of procedure is performed. So if enough people are using an unlisted code and they're including the information, someone goes through the information, and if they can make another code out of it, they will. Also, you're going to see reference to Category 2 codes, which are supplemental tracking codes that may be used for performance measurement. The use of these codes is optional, meaning we're not going to use them in this class. But for performance measurement, these are codes that are normally assigned to a practice that they are tracking. They're tracking how they do certain things, how they bill for certain things, so they make them use supplemental codes. And Category 3 codes are temporary codes used to identify emerging technology, and these will have the letter T in them. Okay, so there's your brief preview of our classroom material. Each chapter contains notes with voice instructions, practice examples, and quizzes. When you visit our site, you'll see links to course descriptions, syllabi for each course, and the required manual for that course. These are college-level courses offered at a fraction of the cost. If you want to learn, we teach.